Hey, part of what we do here at Balance Health and Performance is getting to know our patients really, really well. And it not necessarily, bleeding the boundaries of what's appropriate. It's more just part of, 90% of the diagnosis, it's actually quite a common saying. 90% of the diagnosis is actually found in the history. The problem is most people, a lot of people, really struggle being comfortable with the practitioner that they're actually working with. You're coming in, you're sharing a lot of what's going on for you. Some of it might be intimate, private, maybe you've never shared it with anybody else. And it can be really hard to actually find a practitioner or a team that you can feel comfortable with that allows you to be at ease. And this is why there's something that we practice here at Balance Health and Performance. It's about being professionally unprofessional. And what that means is it's us being pretty much wearing ourselves, our own personality, our character on our sleeve. We are not going to get a coat of armor or this professional screening of, oh, hello, sir, how are you? All this soft, fluffy stuff, which is basically a show to make it look like we're being professional, but really what we're doing is making you feel freaking uncomfortable. And the whole purpose of just being the way that I'm being right now with you is literally as if you're having a conversation with someone over a beer or at a barbecue. And it's exactly how we would treat our family, our friends, is exactly the same way that we would be treating our patients. There's a lot of pretentiousness, a lot of protectiveness, a lot of care, a lot of cautiousness being portrayed by practitioners. And that's just not what we do here. The whole purpose of it is to make you feel at ease and actually get you into a position where we can get to know you, as 90% of the diagnosis occurs in our ability to take a great history. And part of getting a great history is actually getting you in a position where you feel safe enough to open up and tell us about things. At the same time, it may not necessarily be you purposely withholding information. It actually may just be that you don't have enough time to think because the practitioner's too busy trying to force the information out of you, rather than giving you a moment to just ponder, to just think about your problem in a way that maybe you haven't thought about before, to just remember that maybe something did happen a little while ago that you disregarded completely. This requires an environment that's safe, that's comfortable, not rushed. And so what we find is in our profession right now, a lot of people do feel like they're being rushed through because, there's lots of patients and, we're trying to maximize our time. And that's really, yes, it's important, but also it's not important from the point of view of, well, if you miss the point when it comes to what the patient is there for in the first place, then are you really doing your job? Or are you just serving lots of people in a mediocre fashion? So if this sounds like something that you could benefit from, comment below. I've actually put a link in the comments below. If you're interested in a 15-minute free assessment and you're based in Sydney, a 15-minute free phone call, just to make sure that, maybe we're not a good fit, maybe we are. Before you commit, you're welcome to pop your details in the link below, and we can have a conversation. My name's Nick Papastamatis. I'm from Balance Health and Performance. If you're watching this and this sounds like a place that you might benefit from, then subscribe. But otherwise, thanks for joining and have a great day.